Good morning. Good morning. Thank you. Thank you all for coming. My name is Terry Diamond, and I'm thrilled to be your host for today. Thank you so much again for joining us. Before we begin, a few housekeeping items. On the table in front of you, you'll find the brochure, which has the remaining seminars for 2024. I'm working on the schedule for 2025 now. And then, after last seminar, a lot of you commented on your surveys, which I really appreciated, that you needed some type of outline for the presentation. And so instead of doing a PowerPoint this time, I gave you what I thought were the most pertinent points that our guests are going to talk about for you to take notes on. I realize everybody can't see the TV, but we're going to try it this way. Please, when you do your feedback form, let me know how you like it. If it's more beneficial for you, if you have a guideline to take notes on, if you prefer PowerPoint, whatever works for you. Most importantly, at the bottom of your stack, you're going to find the survey. This is where I really need you to be brutal and be honest and tell me all sorts of things that you like and you don't like about the seminars, because it only enhances future seminars. On this sheet, you're going to find, would you like to have a coffee date with me? Okay? You circle yes, I give you a call. We sit down, we have breakfast, we have lunch, we have coffee, we have cocktails. We talk about anything that you want to talk about. Okay, we talk about my dog, which I do anyway. We talk about your dog. We talk about real estate. We talk about trust. Whatever it is that you need to do. Or even if it's going and you just say, hey, I really like Terry, I want to get to know her better. We talk about that too. So whatever you want to talk about, the coffee date is there for you to circle. We'll schedule an appointment. We'll sit down, we'll chat. Once again, please be brutal on the evaluations. Tell me what you like, what you don't like. It's only going to help us get better. Please make sure your phones are silenced. If you need the restrooms, they're out the door to the right. Okay, today's seminar, we're here to educate you on home health care, both comfort care and medical care. We're not here to sell you anything, make you do anything you don't want to do. It's not a sales presentation. However, I'm going to take you a few minutes and just tell you about me. Okay? Then I won't talk about my job anymore. I am a certified senior housing professional. Okay? I'm a realtor, but more importantly, I'm a CSHP, which makes me different. I'm one of 7 people in California, about 200 in the United States, that have gone through extensive training in working with seniors. How we communicate, how we overcome all of the challenges of downsizing or moving when you've lived in a home 40, 50 years. It's hard. I'm here to help you transition into a new place or across the country or into a community, whatever you need to do. We understand mature home buyers and sellers' distinct late in life transitions, needs, wants, and goals. Okay, so it's a whole different ballgame than your average realtor. I am different than everybody else. My goal is more quality than quantity, although I do like to sell houses, but the personal relationship side of selling and buying is so important, especially in today's real estate transaction world. So that's really what I do for my day job, but I really consider myself an educator, and to seminars, an advocate, and then a realtor. Okay, let's get on with the presentation. As a real estate professional specializing in helping seniors downsize, I'm involved in 2 types of meetings. Those who are planning to move now, and those who are planning to move later. The meeting I rarely get invited to is when the couple or individual says, we are not ever moving. Okay, how many people feel that way today? We're not ever moving. Okay, I understand that. Chances are you're not calling me for a meeting. No coffee date for you. What people are really saying is, I want to avoid going to a senior community, and I'm going to remain independent at all costs. Whether you intend to stay in your current residence or make an eventual move, I'd like to provide you with a new mantra. I'm going to live the best life possible, and I'm going to surround myself with people who can help me do that. Okay? And that's what we're here to learn today. These two lovely people are going to talk about how you can live your best life at home. So I'm proud to introduce Zaira Ortiz from Love and Care and Ryan Bice from Central Coast Home Health and Hospice. And rather than me reading off a piece of paper to tell you about them, I'm going to let them do it. Zaira, come up and tell them about yourself.
Thank you. You're welcome. Well, thank you for having me here today. Hi everyone, good morning. My name is Zaira, and I'm here representing a home care organization locally owned and operated in Santa Barbara. I actually recognize some faces. We have some current clients in here, and it's really good to see you. Well, as you know, there are several benefits. Sorry, I didn't mention our company name. The company name is Love and Care. I believe it's a very powerful name for a home care organization. We really care about people. And I want to talk about benefits of being licensed by the California state. For instance, all our caregivers are fingerprint checked. I'm pretty sure everyone is concerned about who is gonna be in my home. It's safe to have a person in my home. Well, at least having a caregiver with fingerprints checked, you will have a peace of mind that the caregiver, didn't have any felony in the past or in the present. So we check fingerprints every 6 months, making sure everything is in place. Second, our caregivers are bonded and insured, which also is a huge relief for families hiring our services. Then talking about services, well, we personalize the care, so the services are different for every client. But I'm gonna give you an example of the different services that we provide. We do assist with transferring, toileting, diapering, light cleaning, meal preparation, medication reminders. Again, this is not limited because we personalize the care. And talking about how we personalize the care. Well, first of all, you need to recognize when there is a strong need of care. If yourself or your loved one is not able to receive a proper care, it is the time when you need to call for help. How to set up the services? You call our company that is actually open 24/7. So, and then you call the company and you explain to us a quick introduction about what you need. Then after explaining if the care is for you or for your loved one, we offer a 45 minutes assessment. The 45 minutes assessment can be offered in your home or can be offered in our office. Then after we come to your home, we talk about your expectation, also about your gender preference, if you prefer a female, you prefer a woman, if there is any dementia care, whatever you need is gonna be addressed during our meeting. Then after our meeting, we'll have 2 or 3 days to start delivering the services. Again, this is about how you set up our services. Then after we start providing the services, we send the caregiver for the first day. And then what about if you don't like the caregiver? Well, you won't be stuck to have a caregiver at home. Let's say you are happy with the services you are receiving, but you don't like the caregiver's personality. Again, you call myself, one of the care managers, or another of our care managers. We come to your home, we address the problem in person, and then we switch the caregivers until you feel comfortable in your home, which is the main goal, feeling comfortable and happy with the caregivers. Then how you communicate with us. I feel this is one of the major benefits about being local in Santa Barbara because first of all, we have an office that I mentioned to you is available for everyone. You will always find a care manager in our office, as well as our executive director, and different people who is gonna be able to help you. We are also pretty good answering the phone. I always give my cell phone to families, so whenever there is a very important issue to be addressed, you can communicate with me and you will be receiving an answer. Unfortunately, our services are no pay by insurance. If you have long-term care insurance, we work with LTC, but then it's gonna be out of pocket. Then it is hard to give you a fee about our services because again, after the assessment that we provide for free, we can give you a better number. It is different, but just to give you a general idea, our services start at $42 per hour. But again, it depends about each case. I don't know if anybody has any questions at the moment about our services.
That was confusing about you work with long-term care, but then it's out of pocket.
Yes, we work with LTC. We work with LTC. They pay for a certain number of hours, so I believe certain number a day, and you need to pay the difference.
Okay.
Yes.
And you submit to them the
Correct.
insurance paperwork. Yeah.
Yes.
So if I understand, somebody calls you, you go out for a free assessment, and then you talk about their needs and wants and their services, and then you start services 2 to 3 days later.
Correct.
How long do your services last?
Well, it's all about family needs, client needs. Can be, we have clients, they have been using our services for, all their lives, but it depends. That's a good question, actually. When you sign a services agreement with us, you have a 7 days notice cancellation. So let's say you need to transition your loved one from hospital to home, and the transition will take a month. Then after 1 month, you can cancel our services, or you can decrease or increase as needed.
Helen?
I was wondering if there's a minimum number of hours per day that you.
Yes, our minimum is 5 hours per day.
Everybody hear the question? So a minimum of 5 hours per day. What type of education do you give your caregivers?
Yes, that's actually one of the most important questions. Thank you, Terry. I was mentioning earlier, we are licensed by the California state. And one of the main requirements is all our caregivers must have at least 30 hours of training on a yearly basis. The caregivers come to our office to have in-person training about activities of daily living, dementia care, and also what to do in case of emergencies.
Okay, more questions from the audience? Arlene?
So what if somebody needs immediate caregiving? Did you have like an emergency, like, I've had situations where something happens and somebody needs a caregiver now. Like, they don't have 3 days, they don't have time for an assessment, they need to get someone in the home. And I have some private caregivers that can do that. Do you have the ability to spin on a dime like that in the case of an emergency?
Yes, we can. That is something that we call crisis cases. Especially when someone has to be discharged from the hospital immediately.
Right.
Yes, we try our best. We use a great strategy. It is keeping caregivers on call. So we pay our caregivers to be on call when we know there is, like a peak, like a weekly peak, when we know it's a crisis for the hospital. So then the caregivers will be on call. Perhaps you call and the caregiver is available. We can supply the care even sometimes same day or next day. In this case, we won't be personalizing the care, will be the first caregiver available, but after a week, we'll be able to personalize, having more consistency with the caregivers.
Okay, so you do have a crisis management, thanks, that's what I
Yes.
want to know.
Yes.
Is there food preparation involved in any
Cool.
of this?
Yes, that's right. It's called meal preparation.
And then is food delivered or you have to have food in the house?
Our caregivers take care of shopping.
Yeah.
They go to the store.
Uh-huh.
They get everything you need, and then following your food preferences, they make whatever you want.
Do you have, you talked about a plan of care. How often do you reevaluate that? How do you communicate with the family?
We usually do it every 2 months, but it can be as needed. You know, as a human beings, everything is unpredictable. So one day you can be walking, ambulating safely, or perhaps after a week you have a fall, and then the care is totally different.
Okay. What's your process, one second, what's your process with communicating with the client's family?
Yes, we have monthly meetings. So we come to the client's home and we talk about how's the care, how they feel with the caregivers, and we can also update the care plan if necessary.
And if something needs to be done sooner, you're welcome to accommodate rather than on a monthly basis.
Absolutely.
If there's a change.
Yeah, I just had a question. You said it was minimum 5 hours a day. Is there a minimum number of days per week?
No,
So it could be 1 day a week or, yeah.
correct.
Maggie first.
Are there any upfront costs that you need to buy in or to pay a fee in order to use your services, or is it just straight out?
Yeah, there is an initial deposit that you make for the 7 days of service. So your deposit will be, let's say if you have 3 visits on a weekly basis, then you will have to pay for like a week in advance. That's called the deposit. That is gonna be returned by the end of the services.
So she has some brochures up on the table that you can grab after, but some of their services, personal care and hygiene, safety, ambulatory supervision. What does that mean? Safety, ambulatory?
Yes, there are several clients, patients, they are very high fall risk. So they need to be reminded to use a walker, or they need a standby assistance.
Okay. Meal preparation, medication reminders. So this is a big difference between what Zaira does and what Ryan provides. So talk a little bit about medication reminders versus medication.
Of course, we I was talking about license by the state. Our license doesn't allow to do any medical care. That's part of what Ryan does. And that being said, we are not able to manage any medication. So no medication management for love and care. However, the caregivers are able to remind. If the families organize all the medication and the meds organizer Monday through Sunday, the caregivers can facilitate the medication, but no management.
Right, so they can't even put the pills in the Monday, Tuesday, Wednesday box. So they can remind you to take them, but they're not allowed to do any medical work at all. Transportation, so if you need to drive somebody to a doctor's appointment,
Yes,
can do that.
absolutely.
Overnight care. So it can be for a minimum of 5 hours, whether it's 8 to whatever, 5 hours, 1, or it can be midnight to 5 a.m. If you need a good night's sleep and your loved one or whoever you're caring for is keeping you up, they can come and take care of the night shift for you.
And actually, let me talk a little bit about that overnight care. I'm pretty sure some of you are daytime caregivers, right? So it can be overwhelming when you are daytime caregiver and nighttime caregiver. In order for you to sleep and knowing that there is a professional caregiver at your home, you can continue, sleeping throughout the night and then continue with your caregiver job during the day. So we always suggest and invite families to at least having 2 or 3 times a week overnight caregivers for those who are 24/7 caregivers. Yes.
Okay. Maggie, then Arlene, and then over here.
Suppose you have a situation where you're the main caregiver and you just need a respite every now and then. Would you do something like that, like provide care a
Yes, that is called respite care. It's also included in our services.
Arlene?
So, two questions. One is, are all your staff members, the caregivers, are they all like, certified personal care assistants, like they have a license or they're, or what level of CNAs, like what is the educational background of the people that you employ?
Yes, the 30 hours on a yearly basis I was talking to you, the caregivers receive a certification which is called home care aid.
But that's not when they come in. What I understood you to say is everybody gets 30 hours of training when you employ them, and then annually. But they don't have to come like as a CNA or personal caregiver, like trained from City College or anything like that.
Yeah, well, we have all type of caregivers.
Okay.
And when I was talking about personalizing the care, depending on the need of the potential client, we supply the care with the right caregiver. For instance, we have CNAs that will be more dedicated for hospice patients. We can have the home care aid, the certification as I told you, for a client who only need assistance with companionship. Or we can have personal care attendant who will have more skills to provide fall prevention.
So depending on what you need, then the cost of the person would be, that's where the hourly rate, the floor is 42, but if I need a PCA, I'm gonna be paying more. If I need a CNA, I'm gonna be paying more.
Correct.
And one last question, is everybody trained in dementia care?
Yes.
Thank you.
Tell everybody what a CNA is.
Yeah, a CNA is a certified nursing assistant. They go to college for 8 months. Well, depending, can be 6 months, can be 8 months. But they are pretty much like nurses assistants. So they work in hospital and they have experience to mainly in our industry, in our business, in our company, working for hospice patients. Since they are able to supply morphine, for example, they will be preparing the syringe to give it to hospice patients. However, the CNAs will be able to apply it. Those would be one of the examples. Also, they have more professional techniques for patients who are, in the need of pretty difficult transfer from wheelchair to bed or from even diaper change for a heavyweight patient. CNAs are always recommended for those cases.
Okay. Did you have a question? Yes, go
I
ahead.
have two questions.
Sure.
First of all, how many clients do you have right now, and how many employees?
Did everybody hear the question? How many clients and how many employees?
I think clients, for me, it's hard to tell. I don't have like the number, but I might say close to 100 clients. And caregivers, like 60 caregivers. 60 up to 70 caregivers.
And as for, this is the second question in particular, transportation to doctor's appointments. Do you have people who are strong enough to get somebody up a flight of stairs in a wheelchair?
We do not provide wheelchair transportation. Our transportation is for ambulatory patients.
So what do you do if somebody needs wheelchair transportation?
Well, we just call any provider, who can facilitate the
Such
van.
as?
Yes, but we don't provide wheelchair.
Are there such providers? I asked somebody who was one of those trucks,
Right.
and they didn't do that.
I think, who is it? Easy Lift?
Easy
Lift.
You have to schedule it though, you can't just pick up the phone, it's not like Uber, you have to schedule it.
And they can get somebody up a flight of stairs?
Well, I don't know why you would have to get somebody up a flight of stairs with ADA, there should have to be an alternative. Yeah, I mean, a doctor up a flight of
Okay.
stairs.
Let's talk about that
Later.
Call Easy Lift and they can give you all the information. They would be the experts. On with this, other things, they provide memory care, Parkinson's care, stroke recovery. So that applies to a lot of people. They can be there and assist with that. It would probably be a CNA. End of life care with hospice, which both of these people do. Housekeeping tasks, companionship. If you have somebody, or if you're living alone and you want somebody to come in and play chess with you. Okay, they can do that. Ellen?
What your turnover rate is like.
Okay, the question was what the turnover rate
So
is.
how good is your company at retaining your employees and keeping them with the same client?
Yes, talking as a care manager and working for a local organization, I can tell you that having a close communication with the caregivers is one of the keys to retain your caregivers. That they are able to see a manager, talk in person about addressing issues, and also we are, I believe we are one of the few agencies providing dental insurance, visual insurance to the caregivers. So our caregivers have these additional benefits. We also pay for vacation. They have vacation on a yearly basis. And also they have, when they feel overwhelmed, when they were very engaged with a patient and the patient passed away, we provide free counseling to the caregivers. And I feel like the caregivers find that very beneficial in our company. And to be honest, our caregivers have been with us for more than 7 years. Yes. And even Jane, I feel like, Adrian, right? One of our caregivers. He's been with us for more than 4 years. He's a superstar and he's just one example of, when they are happy with the company, they just stay. And if there is anything to address, they come to the office.
Right.
One of the reasons I chose these two providers to come is they're both locally owned companies. Zaira owns Love and Care. It serves Santa Barbara
County.
And Ryan with Central Coast Home and Hospice goes from San Luis, Santa Barbara.
Yeah, we go as far as Carpinteria all the way to Paso Robles, but it's because we have a north office as well. So we'll talk about that.
So they're local. They're not big organizations, which for me, I think it makes a huge difference to have somebody provide the services that they provide that understand our community and the people that live here. Because, we're not like anybody else. So, further questions for Zaira? Oh, we're good. Thank you, Zaira.
Well, thank you for all the questions and thank you for your time.
Okay, next up we have this handsome young gentleman, Ryan Bice from Central Coast Home Health and Hospice.
Thank you.
Take it away.
Okay, thank you. Okay, yes, like you said, I'm Ryan. I am a physical therapist. I've been with this company for several years and now have transitioned into what we would call a clinical marketing role. So I can talk about the company with community, with physicians, with hospitals. So it's a good chance to do that. We work closely with Love and Care, their caregivers and their staff, and work well together because our services complement each other. We do provide different services, so that's what we'll go into now. I'm going to speak about both, but we are Central Coast Home Health and Hospice, which are two very different services and different programs. We'll kind of bounce back and forth as we go through some of these topics, but in general, Central Coast provides, we have one sentence, we provide intermittent skilled services to homebound patients. So a lot to unpack in that. So we provide under home health, a patient that is referred to us can qualify for or be ordered by their physician to be seen by a nurse, a registered nurse, or sometimes LVNs who coordinate with nurses. We have physical therapists, occupational therapists, speech therapists, medical social workers, and dietitians. You can go through what all of those services provide, but that is on the home health side. A hospice patient that is referred to us and seen at home for hospice care is able to have services from also registered nurses, sometimes LVNs that coordinate with those nurses. We have home health aides that become involved, or CNAs. Then under hospice, we have a lot more sort of social work and spiritual care aspects. So we have spiritual counselor, medical social workers, bereavement counselors, and even access to music and art therapy, and dietitian as well. So a little crossover between the two as we go, but in general, we work with any patient and any health insurance as long as they are referred to our company via physician order. So we provide the medical care, bring it to your door or to many local assisted living facilities, communities around the area. But we do have to have that initial referral from a doctor, your managing physician. So we provide the skilled services that are ordered and that are agreed upon by your doctor. So we're not a new provider. We don't prescribe or change medications, but we can help you follow orders by your doctor on the nursing side, and then develop therapy plans that are overseen by a physician as well. So when we say intermittent care, that is because home health, more specifically, works in shorter increments, but it can work several times per year. So I like to describe it as we come in to fix a problem in home health. So that problem can really vary. We can talk more about the patients that we serve, but a home health plan of care is often a 30 to 60 day period. It's not the long-term care that continues over time. But when we say intermittent, that is because we can start those therapy or nursing services multiple times per year if there is a new need or a new referral by a physician. So under a home health plan, our nurses, services that a nurse might be providing, it can vary very drastically. It can be anywhere from medication management, like helping someone monitor the signs and symptoms of a condition or a new medication that they're taking, helping organize medications into pill planners and understand the medications that you're taking, whether that's chronic conditions like diabetes or conditions that might require frequent lab draws, things like that. Our nurses also do wound care, ostomy care, you name it. There's a lot of things that our nurses can come and provide to a homebound patient so that they don't have to always be going out to the hospital, going out to doctor's appointments when that is difficult or an effort for them to get out of the house. Same thing with our therapy services. We can come to you, physical therapy, occupational therapy, speech therapy, all would be having their own evaluation, setting their own goals of care. Common reasons someone might work with a physical therapist at home for our company are joint replacements. We have a total joint program. We work with all of the physicians in the area for those immediate first few weeks after a joint replacement surgery where it's difficult to leave your house. You'd be considered homebound. So joint replacements, any kind of traumatic surgeries, more chronic or degenerative conditions like Parkinson's, strokes, MS, ALS, those kind of conditions that we know can change over time and progress, and there are always changing goals of therapy. So that is a application of our intermittent care where we can come in and out when the status of a patient or loved one changes over time. Also, home safety evaluations, like if you need new medical equipment or assistance for medical equipment, where do we put grab bars? How should we go about making the home safer and preventing falls? That is an area for occupational therapy to be involved too. So we talked about physical therapy. Occupational therapy is a service that is about getting back to completing your own ADLs, your activities of daily living. So as a therapist, this is a good distinction really. So if caregivers at home, like those that work with Zaira, help with meal preparation and bathing and showering and all those things, an occupational therapist is involved in that in a different way, where we're working on getting the patient or the resident able to do that for themselves again, if that's possible, or depending on the resident, obviously, or the patient. But that is what occupational therapy would do, is all of our services are trying to restore the person back to what's possible for them. Speech therapy in a home setting can work on swallowing, obviously producing speech, memory problems, cognitive changes, those kind of assessments. We have dietitians that work in both home health and hospice that can assess somebody's nutritional needs, make recommendations, meal planning, not meal preparation, so that's another kind of combined effort. What else? So social workers are involved on both the home health and the hospice side. Those social workers help with things as far as depression, bereavement, assistance in getting community resources, like we have connections with meal delivery, transportation resources, all of those kind of things that someone might qualify for with other organizations in the area, or their health insurance, or IHSS, or SENCAL providers, so all those kind of things. And then those other specialists on the hospice side, under hospice care, you would additionally get access to other more spiritual things and therapies if the patient and family are interested in those things. So that can be art therapy, music therapy, bereavement counseling. We do have a really great volunteer program for just some companion visits for hospice patients, but those, I believe, unless I'm leaving someone out, those are all of our providers that work in the home health and the hospice setting. We talked about getting a referral from a physician initially. We work with any physician. When you are under our hospice program, we have a hospice physician as well, our own, that makes it very easy to communicate when there are changes and when we might need new medications, new orders, that kind of thing. Under a home health service, not hospice, we'd be working with your own physician, whoever referred you or whoever would be appropriate to manage that. We take any health insurance. The distinction is under hospice, typically, unless there's extenuating circumstances, most hospice patients are Medicare eligible, which means Medicare does cover home hospice completely for our company. So even if you have those Medicare Advantage plans or supplemental plans, your Medicare benefit does revert when you sign on to hospice services, so that is covered fully for hospice at home. There are some differences when a person might be getting hospice services in a facility or something like that, but those are kind of extenuating circumstances that we would discuss before admitting. On the home health side, Medicare Part A covers your home health care, so that is the same as a hospitalization. So anyone with primary Medicare standard Part A, home health services are completely free. They're covered fully by Medicare, but that is another reason that those services are intermittent services. So we can get a 30 to 60 day period out of that referral for free. And then we can sometimes reevaluate a situation and extend those that are approved, but when things are not approved or not appropriate to continue after that first 30 to 60 day plan of care, that is why we have intermittent services. So after a month or two, we could get brand new referral from your physician if there was a change or a continued need for our home services. So that is another reason why we work with private caregivers that sometimes help fill those gaps in between our episodes of care when that's helpful or needed based on the person. If you or a loved one do not have Part A Medicare or have Advantage plans or PPOs, HMOs, we do take any health insurance. Those are just the ones where you might expect a copay or a small portion of pay. And those are always going to vary based on that insurance type and the services that are ordered. So whenever we receive a referral from a doctor, we are able to run your insurance eligibility right away, and you would know what your financial liability is before continuing on to our services. So the first visit of both home health and hospice is called, well, home health is called a start of care visit. You're being admitted to home health and you're being admitted to hospice services. During that admission visit, usually a nurse, sometimes a physical therapist, would be the first one to lay their eyes on the patient, do a full assessment of the home, the medical history, and all the needs, and go through our consent forms and paperwork. So that's an opportunity for everyone to be on the same page, know the amount of visits that they can expect to receive over a 60-day time period, the financial liability per visit or for the whole episode of care, and then to have family members involved too. We would always, as with any of these care companies, would have the power of attorney or whoever is signing the consent forms. They're often present on that first visit and can be as involved in the therapies as they want to be. Our therapists always communicate with a primary contact, whether that's a patient or a spouse or a family member of the patient. And so they can always get updates of how visits are going, and they're involved in setting goals for both home health and hospice, and involved in the plan of care. Our therapists, we're proud as a company that our nursing staff and our therapy staff is very heavy on RNs and doctorate level PTs and OTs. We do have some assistants and lower degree level employees that are involved in care when needed, but we're happy to have highly educated and licensed people on our team, and we're also proud that we are very continuous with our care. So if you are evaluated by a physical therapist, you can expect to see that one throughout your plan. Maybe there's changes here and there when needed, but we try to be very continuous with our care so you can expect the same person throughout your visits, because that is often a challenge in nursing and therapy environments, like when you go to a clinic, something like that. Let me think here. We have a couple specialized programs that I can mention. So we said we have our total joint program. Any joint replacement, often knees and hips, sometimes shoulder replacements, might get home health for the first couple weeks where it's difficult for you to get out of the house. We have a Parkinson's wellness program. So a lot of our staff is certified in a specialty program for Parkinson's patients. There are a couple options, but the one that we lean on is called Parkinson's Wellness Recovery, or POWER Moves. We have several therapists that are certified in that, and a Parkinson's coordinator in our North office that is pretty involved in the Parkinson's field in this area. We have a lymphedema therapy specialty. So there are specialty, it can be a nurse, PT, or OT, but work on lymphedema needs. That's swelling in your lower legs that requires wrapping and that kind of thing. We have wound care specialists for when that is needed. Those are often diabetic wounds, surgical wounds, trauma wounds. specialty programs. I think that is it, besides some of our volunteer program under hospice and our art and music therapies. Let me think, see if I missed anything. Are there any burning questions?
Okay.
So under your Parkinson's wellness program, you would provide somebody to come in and do physical therapy?
Yeah, so our Parkinson's, that is a name for home health physical therapy, but that is a therapist that is Parkinson's certified, or certified in a specific type of exercise program for Parkinson's resident or patient. So a home health physical therapy plan of care, you would expect, depending on the situation, you would expect 2 to 3 visits per week for a 30 to 60 day period. So it's very different than someone who spends hours in the house. It's a therapist that comes to you for a physical therapy session, often maybe an hour, but it would be a Parkinson's specialized physical therapist or occupational therapist coming to make a plan of care and work on those therapy goals 2 to 3 times a week for that 30 to 60 day period.
And does the patient have to be homebound?
The patient has to be considered homebound for any home health or hospice service.
And there's a list of requirements?
Criteria, yeah. So the physician that is making the referral determines if the patient is homebound, but homebound status, it sounds maybe a little more restrictive than it is. A homebound patient uses an assistive device, needs assistance to leave the home, and it's a taxing effort to leave their home. So that could be, it's not that it is impossible to leave the home, but it is more difficult and a taxing effort to leave. So going out to a physical therapy appointment 3 times a week would be a burden to have to transport to the car, get out there, spend an hour, come back. Home health is meant to ease that burden. So they are not truly always stuck at home, homebound, but it's a difficult effort, if that makes sense. Yeah.
More questions? Go ahead.
Can your nurses draw blood for blood tests?
We can, yeah. So that's I will answer carefully. We can draw blood, yes, definitely. But the order can't be just for a blood draw. So that's where it gets a little confusing. If you are on services for medical management and a nurse is involved in helping patient, family, spouse, for that, we can do blood draws at any time during that period. We aren't able to take a referral for a one-time blood draw because that wouldn't be covered by health insurance because it's not considered a skilled service. But when we are active with a patient, we can do any blood draws that are ordered by the doctor. Does that make sense? Okay.
Go ahead, Laura.
Does a facility mean just a hospital or a rehab? Or would Val Verde or this Del Monte be considered home?
Are you asking where we provide services in
Yes.
facilities? Yeah, so we can go into anywhere someone considers home. So we work in many of the assisted living communities around here. The only caveat or difference is there are skilled nursing facilities, like if you go to Mission Park or in California, they have their own therapist that would see you. So we would never be involved in those people at skilled nursing facilities, but in independent and assisted living facilities, we see a lot of patients. So they can be home or in those assisted living facilities. And it's very common to receive these kind of services in assisted living because while they have great medical staff, they often don't have their own therapist, so they work with companies like ours. Yeah.
Bonnie, did you have a question?
That was my question too.
Yeah. The only thing I would change in that answer is when we talked about hospice services,
Excluding hospice.
Yeah, it is common to receive hospice care in a skilled nursing facility. And that's one of those things that would change some of the financial implications of hospice. The hospice care would be covered, but you would expect to pay the skilled nursing facility to live there, but that's a different topic.
Okay, so help me understand, if I am in the hospital for knee replacement,
Mhm.
okay, and then I go home and my doctor orders home health.
Yeah.
Do you automatically call the client? How does that transition work?
Yeah, that's a great question. So when a referral comes from a hospital, usually or often a joint replacement surgery like that, it could also be in the hospital for something, maybe a bowel obstruction or something that caused a significant change while you were hospitalized, got weaker, more risk of falls, something like that. A referral would come from the hospital physician or often the case manager, the discharge planner at the hospital, makes that referral, sends it to our company. At Central Coast, we actually have called liaisons that work in the hospital every day. So when possible, we actually can go meet those patients before they even leave the hospital, make contact. But you would expect to be seen by a nurse or physical therapist, depending what was ordered, within 48 hours of a hospital discharge. That is a Medicare rule, so across the board it would be within 48 hours. Our company tries, we're almost always successful at coming within 24 hours. There's always going to be busier times, but we try to get out as soon as possible. You would expect a call from the primary number that is listed in your medical chart that the hospital caseworker or something forwarded over to us. We make that call to schedule your first visit, make sure you want therapy, your house is accessible, the person signing the consent will be there, and then we come for that initial assessment and go from there. It is a little bit different when the only difference in a hospital referral versus a physician office or skilled nursing referral, I guess I'm trying to say that a doctor can also just refer you to home health at a regular doctor's appointment. You don't have to be in the hospital or something like that. That referral would go to whoever your doctor prefers or chooses or you prefer. There's always a factor of a patient choice too. So if you have a preference for a company, you can always let the doctor or the case manager know.
So correct me if I'm wrong, if you will do all the billing for Medi-Cal or insurance companies, and if you have Medi-Cal Part A, then there's no deductible, where if you private pay through your insurance company, there could be a deductible.
Yeah, so Medicare and Medi-Cal are always going to be covered completely. If you have those other types of insurance, like Medicare Advantage plans or HMOs or PPOs, we still accept those insurances and the in-network benefits of those insurances, but you might expect a copay per visit. And those vary based on the insurance, but you would be aware of that at the time of the first visit to decide if that was acceptable to you.
Okay. How often do you communicate with the doctor?
So the doctors make the initial referral, and then after the first visit, the first clinician makes their electronic documentation that includes the goals of care, the amount of visits, all of those things. That's signed off by the doctor within the first 5 days. So the doctor is, the physician that is overseeing your home health is aware of the goals that are set and the amount of visits, or at least the estimated amount of visits that you're going to be receiving during that time. They sign off on that, and then they would also be involved every 30 days for those plans that we maybe get to extend a little longer.
Okay. What other questions? Yes.
How many employees? in the southern?
Yeah, that's a hard question. I will be estimating a little. I know we have 14 full-time therapists in Santa Barbara alone. We have 20 full-time nurses in home health. Home health and hospice nurses are different because they're different specialties and different attributes to those jobs. But we have 10 hospice nurses, about 20 home health nurses. And then, yeah, we said our company does expand or continue from Carpinteria all the way to Paso Robles. That's because we have two parallel offices. We have an office right here in Santa Barbara, and one of our owners lives here in Santa Barbara. He was our first physical therapist. And that's the Giordano family. Most people know them, but and then we expand all the way up. So we're growing very rapidly, but slow enough that we still make sure we have good quality care, because that's what's most important to us.
What are the questions?
Brian, could you just tell me, what's the difference between the services you offer in home health care and say VNA? Because I was interested to hear that you have Parkinson's
Yeah.
specialists for physical therapy.
Right. So VNA is another certified home health and hospice company. So we are competing or parallel companies. What I like to think sets us apart is that continuity of care. We're really good about sticking with continuous therapists. We have we employ nearly all employees at the top of their degree field. So hopefully doctorate degrees in PT and OT, and then all registered nurses. Or we have some really great LPNs too, but highly educated. People really love staying at this company. We have been in Santa Barbara for going on 10 years, and we have many employees that have been here for all 10 of those. So so good employees, good specialty programs like our Parkinson's and our specialty wound care, our total joint programs. I didn't even mention that we actually do have our own pharmacy and our own DME, medical equipment company. Those are more heavily used in hospice patients, but that allows us to get medications to hospice patients very quickly because they're our own pharmacy, our own medications, our own medical equipment. And we're all just nice people. I don't know.
So with Parkinson's, you said that care is intermittent, right? So a person may get specialty Parkinson's PT for, what did you say, how many months? 30 to 60 days.
Great.
And then at a certain point they could renew and get that.
Yes.
Yeah.
So that is the beauty of an intermittent service for a degenerative condition. We can't do therapy forever because Medicare would not pay for that, and that would be reasonable. But what we can do is come in to solve a problem over a 30 to 60 day period to set up an exercise program that someone continues on their own. They continue that for a 2 to 3 month period, the best that they can, and with a new referral from a physician, or anytime a new problem or a change occurs, we come right back with a new referral. So while we can't continue indefinitely, we can do frequent, I call them tune-ups or check-in episodes of care while someone is dealing with a degenerative condition.
Okay, Ellen, and then Jim, and then we'll get back to you. Ellen?
I'm just curious if you have a care facility like Serenity House.
We don't. Serenity House is a great place for people that need it. So Serenity House is an inpatient hospice home for, it is owned by Vina, who is another home health and hospice company. While we don't have an inpatient hospital location. We work with, there is another inpatient hospice location called Zaira House here in town for, it's more for low income patients, but we do meet people's hospice needs there and help place them there. And then that's when our patients would consider going to like a skilled nursing facility or a boarding care or something if they weren't comfortable at home. So we can help meet hospice needs in other locations other than home, but we don't have a location of our own just yet.
Can they work with you in hospice and then transfer if they need Serenity House, if they need a place to go?
Yeah, that's okay, and that happens often. We can, like our own home health patients may progress or transition to hospice with us, and then if it's appropriate if there was a need or they were wanting to go to a place like Serenity House, that's always okay. Yeah. Ultimately, the patient can always choose the company that they want to work with, and we always understand that.
Jim, did you have a question?
Maybe related to the one about the care. So for something like, say, joint replacement, knee replacement, is 60 days enough to cover the therapy for that?
It's not. So what is often the case, usually the orders that we receive from a physician after a joint replacement is only for 2 weeks, because the physician is always going to prefer that you, after those first 2 weeks, progress onto outpatient therapy, where you go into a clinic that has access to machines, treatment tables, all that kind of stuff. So our home health plans of care are often only 2 or 3 weeks for those total joint replacement patients, but that is because of the way the physicians have those referrals lined up. Because it's usually common we see you for the first 2 weeks, help with those immediate concerns in the home and get established with an exercise program, do the wound care or staple removal or whatever it may be in those first 2 weeks, and then you progress on your way to outpatient therapy. And now that I'm saying it out loud, part of that is because after 2 weeks, you would not be considered homebound anymore, because at 2 to 3 weeks after a joint replacement surgery, you should be, while you're not driving yourself, you are more able to get to an outpatient clinic for therapy.
Okay, yes.
This is a plug for your company.
Oh, thanks.
My husband used you for a knee replacement about a year and a half ago, and it was very seamless.
Perfect.
Thank
The
you.
provider was very good.
Yeah, that's great. Thank you.
More questions? Thank you, Ryan.
Thank you.
Okay, I hope y'all learned a few things. I want to cover a couple myths and truths about home health care and hospice. So, the myth, I can save money by hiring a caregiver outside an agency. Okay, that statement there, so many things wrong with it. You don't want to hire somebody off Craigslist to come into your home and take care of you. Okay, whether it's just play cards with you, or to do your shopping, or do your meds, please don't do that. Please go to a licensed provider, whether it's Love and Care, Home Health, and Hospice, or anybody other than somebody off Craigslist. Please. Theft, insurance, problems, way more than I have time to go with. Home health and personal in-home care can't be used in a retirement community setting. True or false? False. Correct. Home health and personal home care services can be used in independent living, assisted living, and memory care. I am required to use a company recommended by my doctor or nurse. True or false? False. You guys are smart. Let's see. Myth, or true or false? All licensed companies do the same thing the same way. No. False. You got it. And true or false? Okay, this is an important one. I can handle it myself with a bit of help from my kids and a few friends. Okay? Caregivers are under an immense burden. You know, if it's a week or 2 weeks or even a couple of months, caregivers can handle it. But when it's a lifelong process, caregivers need help. Your kids can come up for the weekend, or somebody, the neighbor comes over and watches while you go to the grocery store. Not enough help. The emotional and the physical part of being a caregiver is so draining. How many here are caregivers? Now or currently or in the past? It's a lot. It's a tremendous burden on both parts. The patient maybe doesn't want to ask for things. The caregiver gets burnt out, maybe has resentment, but it also takes a physical and mental toll on the caregiver. So, organizations like Love and Care offer that companionship care where you can get out of the house 4 hours a week, 3 times a week, or 5 hours a day, 3 times a week. That does so much more for your mental health. If you have a medical need, organizations like Central Coast can come in, give the caregiver the respite needed. There are also many places that provide respite care for the patient, in-house or out of house. Some of our communities offer a week-long vacation, not only for the patient, but for the caregiver, that they can go and stay and have somebody else care for them, okay? Really important. There are so many resources, far too many to cover here, but you can always call me, call Ryan, call Zaira, ask them. We can always give you extra resources. Any more questions before we move to the door prizes? Okay, surveys? Yes, Maggie.
Do you happen to know if there are companies that do not have a 5-hour minimum?
Pretty much everybody's a 4 or 5 hour minimum,
Yes,
isn't
I
it?
think that's the minimum.
4 or 5?
5, and actually there are some others that require certain number per week. I mean, certain visits per week. So like 3 or 4 visits a week.
So you said they don't hire somebody who's not certified, but if you only need 3 hours a day, what do you do then?
I would recommend making it the 5 hours a day, just less days per week. I don't know, your situation is different than everybody else's. Do you have any?
Well, as I was, sharing with you about the program, the services, you can always take advantage of, having the caregiver helping you with shopping, like cleaning, laundry. That's what I can see the majority of our clients do. They totally use the 5 hours per visit, because let's say, just to give you a quick example, our most common program is shower assistance, dressing, personal care, breakfast preparation, then washing the dishes after, then taking a walk with the patient, coming back to the home, a little driving around the city, then they do like cleaning, laundry. So after, everything I mentioned, it's been the 5 hours already. So this is the program that we offer mainly for, in your case, I think if that sounds familiar, we can always personalize, but this is how we use the 5 hours.
So you could use it not only to help care for the patient, but use it to help care for you by doing the laundry, by doing the cooking, by doing the shopping. How many of you still want to do this? Not me. I mean, my housekeeper comes every week and it's still not enough hours. Okay, surveys. Yes.
I do have one question. What is the law in here for all of these services? Are they the same all across the country? So are they gonna work? Or like if I find an agency in Ohio for my sister, are they gonna be under the same regulations?
My guess would be it's hard to know from state to state. What we can,
Correct. It's
we
different.
know what's regulated for California. I can't speak for other states.
Yeah. Okay, thanks.
So, surveys, let me know if you want to have a coffee date. I love to talk about Loki, who's my dog. Next time I'll bring a picture, whatever you wanna talk about, really. There's downsizing evaluations, there's a lot of other questions on there. Please let me know what you liked, what you